and parental guidance is advised.
The Female Health Talk on Conversations is brought to you by MedExpress Pharmacy.
20 minutes to 8. This is Conversations on Energy FM 102.1 and Choice FM 101.1. It's consultation time with our resident gynecologist, Dr. Maluleke. He has stepped into the studio just in time for all of your questions that have to do with issues around female health. So this is how you can get in touch with us if you would like to ask the doctor a question that has to do with female health. Our WhatsApp text line is 079-295-1212, 079-295-1212, or you can send a voice note to 060-771-5107, 060-771-5107, or you can give us a call.
Have your say. Call us now on 015-151-1058.
Doctor, good evening. Welcome.
Good evening, Rebecca, and good evening to our listeners.
How are you tonight?
I'm very well, and how are you?
I'm well, thank you.
Sure.
So we did apologize before we concluded our engagement last Thursday to say there were quite a number of outstanding questions that we did not deal with, so we'll start with those before we get into tonight's questions, which have already started coming in. This one reads as follows on the WhatsApp text line. Good evening. We have had twins born in July. Then the expected bleeding took place for quite some time, and then it stopped along the way. Now it appears, and she's bleeding again, which is about 3 days now. No period pains. She had them even before pregnancy. Anyway, now could that be menstruation, or is it the body still cleansing itself? If so, for how long can we expect this to take place? The babies are 10 weeks old now.
Right. The bleeding that is related to the birth of the baby is expected to have settled by the 6th week or 42 days after the birth. Today we are in September, and the delivery took place in July. So at the moment, we can no longer say this is pregnancy related. It is probably her body now getting back to normal. It could actually be a period that has started. But depending on what method of conception she's taking, if she, for example, has been given the injection for prevention, it could actually be related to that as well. But if she's not on contraception and she has seen this kind of bleeding, I would say menstruation has come back.
So there's nothing to be alarmed about?
No, not really.
And the fact that they relate the menstruation that's happening now to bleeding that often, or menstruation, I'm not too certain what the correct term is, once one has given birth, it could mean that perhaps the flow is also questionable for them.
Well, they might notice a bit of change, like he's saying there is no pain.
Yeah.
You know, we know that people who experience a particular type of period pain will find relief once they give birth to their first child. So the fact that there is no pain need not make them think that this is not a period. She could actually be one of those who are going to experience painless periods following the birth of her children. So I'm not worried at this stage.
Okay.
Yeah.
Another question. Good evening, Dr. and Rebecca. I got vaccinated for COVID-19 last month. Can I try to get pregnant now, or should I wait? And if I should, for how long? Is it safe?
There is no need to wait. Once she has been given the vaccine, that's fine. The only precaution that we advise with regards to pregnancy is that between the time you miss your period to the next 14 weeks, you should not get the vaccine, because but by virtue of the type of infection that we're having, which is a new infection, we don't have much experience in terms of what it could do in the early stages of pregnancy, during the time when the organs of the baby are forming. So to avoid potential teratogenicity, we would advise in general that people should avoid taking any form of medication in this period, from the time that you miss your period to around 14 weeks, because that's the time when the organs are fully formed. And that is the maximum, at the time when there is a lot of changes that are taking place in terms of fetal development. Therefore, that is also the time at which the fetus is vulnerable to developing abnormalities. So that is the time we would avoid giving the injection or the vaccine to anyone. But prior to pregnancy, you can get it safely. There should be no problem.
All right. Good evening, Rebecca and Doctor. Can you please help me? I've got a wife and we have a baby aged 7 months. We found that she's pregnant again, and since last month, she developed pimples around her vagina and she complained about itchiness and pain. We consulted, we got medication, and they said it's an STI infection. Now my worry is that if she can take the medication, will it not affect her pregnancy, because the doctor gave her the pills to put inside of the vagina? Please advise, because I advised her not to start using the medication since we're not sure when, and so we should perhaps go to the doctor.
Well, I'd like to assume that the doctor was aware that she's pregnant at the time when he prescribed the medication. This is very important. If you are pregnant and we have to give you medication to treat any type of condition, we would try and give medication that we believe to be safe. Although, like I said on many occasions, we do not have any medication that has been tested, the usual or the correct way in pregnancy. But most of the medications that we give has been based on observation, that people may have taken the medication during pregnancy and nothing happened to their babies. As a result, when you look at any package insert, you'll find that when it comes to pregnancy, they will always say, please seek the advice of your doctor. Do not take it unless you are advised by your doctor. So even if the doctor was aware that she's pregnant, he would prescribe this medication that is believed to be safe, even though it may not have been tested to be the case. And some of the patients, actually, when they get the package insert, they read it, and then they phone and say, but doctor, I've just read here, they say this medication you prescribed for me is not safe in pregnancy. And we often reassure them to say, no, go ahead and take it. But if the doctor was not aware that she's pregnant, then there could be a problem, because there are drugs that we must avoid in pregnancy. Some antibiotics, for example, if you are pregnant and you are given an antibiotic that is known as a tetracycline, that would definitely affect the development of your baby. The bones and the teeth will be affected. So, but the other antibiotics, the penicillin group of antibiotics, most of them are safe, can be given safely.
Okay.
The itchiness that she's talking about, I want to assume that this is probably thrush. The treatment for thrush, fortunately, most of it is given topically. Topically means you apply it on the area which is affected, and therefore there is no systemic absorption of this medication. It does not get into the system. You apply it usually on the vulva, sometimes in the vagina itself. There is no absorption, and most of it would be safe. The problem would be medication that you drink, which gets into your bloodstream and can actually find its way to the baby. And we try and avoid those.
So this medication that would be applied, is it the one that ideally you would give to a pregnant woman who's got an STI?
Well, most STIs would be systemic in nature.
Okay.
And most of the time you give them medication that gets into the bloodstream. All right? It is not syphilis, for example, or even gonorrhea. These are bacterial infections that are transmitted sexually. You need to give them medication that they drink. Sometimes you can even give it using the drip, depending on the severity of the infection. The topical ones would apply to conditions such as thrush, conditions such as bacterial vaginosis, because these are confined to the vaginal area and they are not found in the bloodstream. Therefore, topical application would apply to those.
All right, I'm in conversation with our resident gynecologist, Dr. Maluleke. We are taking all of your gynecology related questions. The doctor is here to answer all of them. This is how you can get in touch with us. Our WhatsApp text line is 079-295-1212, 079-295-1212. The voice notes line is 0607715107, 0607715107, or you can give us a call as we continue with this conversation after the break.
The content in this segment is not suitable for listeners under the age of 16, and parental guidance is advised.
COVID-19 has been stressful. Take care of yourself by exercising regularly, getting enough sleep, connecting with others, and eating a variety of fresh, healthy foods. Health services like contraception, HIV treatment, and post-violence care are still available, even during COVID-19 restrictions. You are not alone, and there is help available. Talk to someone you trust if you feel bad, or call Lifeline's free counseling helpline 0861 322-322. This message is brought to you by NACOSA with funding from PEPFAR and USAID.
We understand things have been tough. The COVID-19 pandemic has made life challenging, especially our well-being. Now is the time to make 2021 the year of good health by getting back onto your HIV, TB, diabetes, or any other chronic illness treatment to ensure a healthy life. Your local clinic is fully operational and eager to welcome you back. Your health is in your hands. All COVID-19 prevention measures are in place for your protection. Brought to you by Nova Health with funding from USAID in partnership with the Department of Health.
Treat your body to the relaxation it deserves. Awaken your senses with the Sensit Bubble Bath range from Phatsima, with added glycerine and 4 lovely fragrances to suit every mood. Available closer to you in Polokwane, Mokopane, Tsanin, Phalaborwa, Leboahomo, Zibidela, Makado, Thoyando, Giyani, Marble Hall, and now in Groblersdal. To find affordable, long-lasting quality cleaning products, follow us on Facebook at PCS Phatsima and WhatsApp 072-949-1609. Sensit Bubble Bath. Awakening your senses.
The relief for small businesses has landed at Cartridge Hub. They sell toners and cartridges for all kinds of printers. They are the cheapest in Limpopo. Visit their store at shop number 10A Polokwane Lifestyle Center, corner Landros Mare and Market Street. Cartridge Hub has a new store in Giyani at shop number 15 New Moon Complex. Go visit them for massive savings on ink, toners, cartridges, and stationery. Call 015-004-1146 or email them on salesgy@cathhub.co.za for quotations. Get more information on www.cheaptonerslimpopo.co.za. Cartridge Hub, affordable quality toners.
Conversations, Mondays to Thursdays, 6:30 to 8:30 p.m.
The content in this segment is not suitable for listeners under the age of 16, and parental guidance is advised.
The time is 6 minutes to 8. This is Conversations on Energy FM 102.1 and Choice FM 101.1. I'm in conversation with our resident gynecologist, Dr. Maluleke. He's answering all of your questions which have to do with female health. And this is how you can get in touch with us if you have a question for the doctor. Our WhatsApp text line is 079-295-1212, 079-295-1212, or you can send a voice note to 060-771-5107, 060-771-5107, or you can give us a call.
Have your say. Call us now on 015-151-1058.
015-151-1058. That is the number to dial. Doctor, let's take a voice note.
For me, it would be what causes bleeding during sex or after sex. Not like period bleeding, but bleeding as in blood bleeding. Number 2, what causes odor more what causes odor. Number 3, what can you do to prevent the bleeding during or after sex?
Doctor?
Right. Number 1, what causes bleeding during sex? There are a number of things that can cause bleeding, right? Namely, it could be any inflammatory condition such as thrush, or if the sex is very vigorous and rough, you can cause some abrasions that may lead to bleeding. But you could also be having local lesions such as polyps, which may lead to bleeding, because these are lesions that bleed easily when provoked, when you touch them. You can also bleed depending on your menopausal status. If you are menopausal, the vaginal lining tends to thin out because of estrogen deficiency, and can easily be damaged because there is dryness there, and with dryness that and thinning of the lining, it is quite easy to bleed during intercourse. But of all these conditions, we worry mainly about cancer. Cancer of the cervix would be one of the reasons why people may bleed. So to try and establish the reason, she needs to go and see a doctor. When she sees a doctor, they will then, among other things, they will do a pap smear if they do not see any abnormality on the cervix. But if they see a lesion, they will probably take a biopsy of that lesion and send it to the laboratory. The lab will then tell us exactly what is causing that. Right. Therefore, the treatment will depend on the cause. Like I've mentioned, different conditions. You can't give one treatment to all of them. They need their own treatment depending on what you are suffering from. The issue of odor could also be related to the bleeding. Conditions that lead to you bleeding during sex may actually lead to bad odor, because when you bleed, not all of the blood tends to come out. Some of it will stay in the vagina, and when it is in the vagina and it stays longer in there, the vagina has a lot of bacteria. When this blood mixes with the bacteria, you tend to have certain reactions, and that will lead to odor. But one of the commonest reasons why people may get odor would be bacterial vaginosis. Bacterial vaginosis is not an infection. It's just a condition you get as a result of the changing milieu or the changing environment in the vagina due to hormonal activity. You've got, like we said on numerous occasions, you've got a delicate balance in the vagina, which is dependent on the acid content or the pH in the vagina. The vagina is an acidic environment. When things are normal, you've got a pH of 3.5 to 4.5. That's normal. Once the pH changes and it goes beyond 4.5, you now move towards the alkalinic nature. Then these bacteria that you find normally in the vagina tend to overgrow. When they overgrow, they start to release certain chemicals that will lead to the odor that some women will get. And because this is a hormonal thing, it's something that might recur. Even if you get treatment, you get better for a while, then it comes back again. And this odor, those who have very good noses will tell you that this is a fishy smell, more like a rotten fish. That is bacterial vaginosis. I know that there are people who will go over the counter and buy certain, deodorized substances that they use to cleanse the vagina. Whilst that might take the odor away, but you could also create other problems when you do that. The simple thing to do would be to consult and be given medication. If you believe in cleansing yourself, you can just use water with just water alone, or maybe add some bath salt in there. The other things we don't encourage.
Okay.
Yes.
Oz Humane or Humane Gamuyeshe has said, I would like to ask the doctor, my wife just gave birth a month ago, so is it advisable to make love to her at this stage?
There's no reason why not. as long as she is comfortable to do so, right? But they must know that that also increases the chances of her falling pregnant. Therefore, before they start engaging in intercourse, they need to be on some form of contraception, because some women tend to not see their periods soon after the birth, and some of them will even conceive before they see their next period. So if they want to start engaging in intercourse, they must make sure that they are on conception as well.
Okay. Tata Gonyama wants to know, what does yellowish discharge that is odorless indicate?
Yellowish discharge that is odorless could actually be a thrush, because thrush sometimes can be yellowish, sometimes it can be like cottage cheese, sometimes has a bluish or greenish tinge, if you like. So it has all those things, and it might itch as well.
All right, doctor, if one is on contraceptive pills and they decide not to take them any longer, how long does it take for them to fall pregnant?
The reason why you take the pill daily is because it gets eliminated within hours of stopping. So you can actually conceive in the next cycle.
Mm-hmm.
In your next cycle, you can fall pregnant.
It doesn't take too long.
No. Return to fertility after taking the pill is immediate, as opposed to the injection. The injection can take months in some people, because it is slower to come out of the system. Whereas the pill, people taking the pill, they may actually fall pregnant on the pill because they actually skipped one dose. So it's important for people taking the pill to know this. So if you stop with the intention to fall pregnant, you can do so within the next cycle.
All right. Good evening, Rebecca and Doctor. I had vaginal ulcer and warts, which were inside the vagina, in August. I went to the hospital and they injected me and gave me oral pills and a cream to apply. I noticed that the warts are still there, but they are small. Should I be worried?
Yes, if they're still there, you should worry, because it means they have not been eliminated. Now, the main worry with warts is that you are vulnerable to developing cancer of the cervix. There is an association between warts and cancer. So one of the things that you do would be to go and have a pap smear done, right? And if you are worried about the warts, you also need to continue getting medication. There are various methods of eliminating the warts, or treating the warts. As for elimination, the virus that causes warts, the human papilloma virus, once it gets into your system, it stays there permanently, right? So you can't get rid of it. And there are many, many people who have it. Some of them are lucky because it does not cause any problems. But there are those who develop warts, and there are those who have cellular changes of the cervix that may precede cancer of the cervix. So once you know yourself to be infected, make sure that you've got regular pap smears. At pap smear, one of the things that we do nowadays is to try and get the type of virus that is affecting you, what we call genotyping. Because these are many, many, many viruses that fall into this category of human papillomavirus, or HPV. You've got the low-risk variety and you've got the high-risk variety. Low risk, not associated with cancer, but high risk, often associated with cancer. So if you get the pap smear done, it shows that you've got human papillomavirus. The lab will then be asked to do the genotyping. If they come and say this is a high risk, then the follow-up is aggressive as well. But if it's low risk, we can take it easy without necessarily worrying about you getting cancer.
All right, let's take a voice note.
To ask Jorge, how long can somebody use vaginal cream without consulting a doctor, and what are the effects of it using for like a long period of time? Thank you.
Doctor?
It is a bit of a vague question, because what is the vaginal cream for, right? There are many different vaginal creams, right? There are creams that we use to treat thrush. There are creams that we use to treat bacterial vaginosis. There are creams that are hormones that are given to menopausal people. And therefore the treatment or the duration will depend on what we are treating. In general, when we treat infections, we would not exceed 7 days, right? You must take it for a minimum of 5 days, not less, and you should not exceed 7 days. If we are giving you hormonal preparations, these are continued for as long as you need them. So we need to hear what kind of cream the listener is talking about.
Mm-hmm.
Yeah.
If you would like to ask a question to the doctor, this is how you can get in touch with us. Our WhatsApp text line is 079-295-1212, 079-295-1212. That's where you send your WhatsApp text message. If you would like to send a voice note, the number is 060-771-5107, 060-771-5107, or you can give us a call. The number to dial is 015-151-1058, 015-151-1058.
Have your say. Call us now on 015-151-1058.
We go back to the WhatsApp text messages. Good evening, Dr. and Rebecca. Is it normal to experience one's period a day after intercourse, even though they had their period before?
No, it's not normal. It would still fall within the category of what we call post-coital bleeding or contact bleeding, like that we have addressed a bit earlier. If you have seen your period, a normal period, then you have intercourse and then you bleed a day after, we can't say that is a period. We need to establish the reason why. So it would also fall in that category where you need to go to your doctor and explain this to the doctor. The doctor will then try and find the reason why you are having this kind of situation.
How common of an experience is it, doctor?
Fairly common.
Okay.
Fairly common. But some people just dismiss it and say, no, it is a result of sex. So, and there are those who will say, every time I have sex, I bleed. You should not be complacent when you have this kind of situation. It could indicate a serious underlying condition. You need to do something about it, and the step you take is to go to a clinic if you can, but then go to the doctor. Sometimes the problem can be sorted out by the sisters at the clinic, but a pap smear remains the common factor there.
And on a general scale, as soon as a person says they experience post-coital bleeding, what does it immediately hint for you as a practitioner?
Right. In the older women, we would always want to exclude cancer, right? In older women. But in the young people, like I mentioned, the number of conditions, you will find that cancer is not one of them. But once you are older than 30 and you start to experience this sort of thing, you should worry about cancer. And we would urge you to go and be investigated accordingly.
All right, doctor, let's take a voice note.
Rebecca, I just have one question. I wanted to know, what does it mean when when I get intimate with someone who is uncircumcised? What does it do to me as a woman, especially if we are not using protection? Should I be worried, or really, because so far I've been in a relationship with someone who's uncircumcised for 2 years now, and we sometimes don't use protection, but honestly there are no side effects or whatnot. So should I really be worried, or maybe encourage my partner, or is it okay?
Doctor?
Well, circumcision and non-circumcision must not have any effect on the female as such, but it may have an effect on the male in this way. When HIV came onto the picture, and just like we have the problem with corona, when it came, HIV, we did not know much about it, but after some time it was observed that men who are circumcised tend to get less infected with HIV. All right, so being circumcised does seem to protect men from getting HIV. Okay, so it would affect the man more than the woman. The fact that he is not circumcised should not be a problem for her, but it should be a problem for him if there is an HIV infection in the partner. He can easily get infected.
In the female partner?
Yeah, in the female partner.
Okay.
Remember that transmission from female to man is not as efficient as from man to woman. In other words, if you've got a couple, you meet for the first time, the man is the one who's positive and the woman is negative. It will just take that first coital, it may take the first coital act for the woman to get infected. If, on the other hand, it is the woman who's infected and the man is negative, they can be together for a long time without him getting the infection. And this would even be more if he is circumcised.
All right, let's go back to the WhatsApp text line. Doctor, what causes brown discharge a month after a depot contraception shot?
It is the side effect of the depot. The brown discharge just tells you that this is altered blood, because when you get the injection, both of them, whether you get the bi-monthly one or the tri-monthly one, you will have some degree of abnormal menstruation. And as the injection takes effect on your body, it's no longer just bleeding. It will be this brownish discharge that they are talking about. So it's a side effect of the injection. And with time, everything will stop as long as they continue getting the injection. They will not see their period anymore.
But it's quite expected.
Yes.
All right. Another voice note.
Dr. Rebecca, I just want to know whether it's normal to menstruate for 3 days, or let me just say, what is the maximum days for a normal menstruation?
Good question. Menstruation should, the duration, or what we call the period. I hope the listeners know the difference between period and cycle. The period should range between 3 to 7 days, right? If it is less than 3 days, this is what we call scanty, or what we call hypomenorrhea. If it is more than 7 days, it is too much and could also indicate an underlying problem. So 3 days is normal, definitely. Yeah.
All right, good evening. I'd like to start using the needle injection as a form of a contraceptive. So my question is that, must I start that while I'm on a menstrual experience, or can I start that anytime?
Ideally, you should start it when you're menstruating, but you can also take it any other time. There are conditions. If you take it during a period, it will be effective immediately. This also applies to the pill. If you take it randomly, you're not menstruating, but you start it, you will not be protected immediately. It will take 2 weeks or 14 days to kick in. This is important because there are people who will come and say, I got my pill and then I conceived immediately. Because they were under the impression that taking the pill will protect them immediately from falling pregnant. Then they don't take these necessary precautions, and then of course they conceive. So if you take it randomly, not during your period, you either abstain from intercourse for that period of 2 weeks, or until the period comes, depending on which one comes first. If you cannot abstain, then you are advised to use other methods of conception until that period elapses. In other words, you got your injection, use the condom as well until 2 weeks elapse. If you don't do that, you can actually conceive.
Okay.
Yeah.
Good evening, doctor. I have a bleeding problem. I went to the doctor. They gave me medication and then it stopped. After a week, it started again. I went to the gynae. He gave me medication. It stopped. Then it started again after a week and it's heavy. The gynae told me it could be hormonal uncertainty. He doesn't see anything wrong with my womb. Should I be worried, and how can I deal with this permanently?
Right. Well, they're talking about hormonal uncertainty. I think what she's trying to say is hormonal imbalance. And that would actually fall in the category of a polycystic ovarian syndrome, which is what we have talked about on numerous occasions. These are people who have a condition that is not you can eliminate it by giving medication over a week. It is a condition that will be with you for the duration of your reproductive life. Therefore, we can't say there is a permanent solution. The idea would be to give medication to regulate the cycle. And of course, the next thing that's going to kick in is the issue of reproduction. If you have got polycystic ovarian syndrome, you're going to struggle with this kind of bleeding or irregularity of your cycle. You'll also struggle falling pregnant. So the treatment will be given to address those two issues. One, to regularize your cycle, or two, to improve fertility. So if she is not intending to have a baby, the best solution for her would be to take the pill. The pill will definitely get her period back to normal. And then she can take it for as long as she is not intending to have a baby. When she wants to have a baby, we then switch to other form of treatment to now stimulate the ovaries to ovulate, because there is a problem of anovulation here. They don't ovulate, and because they don't ovulate, the cycle is not normal. Okay. So the discriminator here would be, do you want to have a baby or don't you want to have a baby? Right.
I want to understand the aspect of her having been given medication by the doctor, which she says would work and then would not work.
Yes.
Help us understand what is the reason there.
The idea is to try and get a cycle back to normal. We give them medication, and then when they finish the medication, usually 3 to 4 days after finishing, they start bleeding again. Okay. It is an attempt to try and start a new cycle.
Okay.
All right. So unfortunately, women would say, but why am I bleeding? I've been given this medication, it stopped. Then when the medication gets finished, I bleed again. But the thinking behind is that we want you to get into a new cycle. So this new bleeding is now the beginning of a new cycle.
All right. I'm in conversation with Dr. Marudeke. He is our resident gynecologist. Consultations are underway. If you still have a question that you would like to ask the doctor tonight, this is how you can get in touch with us. Our WhatsApp text line is 079-295-1212, 079-295-1212, or you can send a voice note to 060-7715-10706, 0771-5107, or you can give us a call as we continue with this conversation after the break.
Have your say. Call us now on 015-151-1058. Conversations with Rebecca Pala.
What is at play here, Mr. Masora? How do you understand this crowdfunding campaign by the ANC?
You know, I firmly believe that the ruling party, the ANC, is clinically suffering from its own organizational renewal project. Because the ANC, you took a decision that you want to renew the organization, you want to fight corruption, not only in government, but corruption within ANC structure. So to a certain extent, it will also affect the financial muscles of the ruling party. The service providers who used to donate to the ANC, knowing fully well that they will get tenders in government, they are no longer benefiting in that regard, and they will start to be very hesitant to support the ANC financially. So that's why you happen to see the ANC where it is right now. But in the long run, it will be a good investment because you will remain with business people who are prepared to do the right thing, rather than business people who will only find you knowing that you must promise them something in return.
Conversations, Mondays to Thursdays, 6:30 p.m. to 8:30 p.m. with Rebecca Pala.
On the pill.
Get more bucks a birthday when you buy Goldie Chicken 5 kg.
Visan.
Buy 3 for 450 rand and get Twizzler 2 liter free.
Is the doctor referring to? She has got 3 kids. The bleeding lasts for more than 7 days.
Visan is not the contraceptive pill. The pill I'm talking about is the contraceptive pill. Visan is specifically meant for treating endometriosis. Alright? The one I'm talking about is the hormonal regulation of her cycle. And I'm talking about the combined oral contraceptive pill.
486-6288 or visit our Facebook page at Taku Confectionery. Taku Confectionery, deliciously baked for you.
Every human being has the right to be safe and live in an environment free from abuse and violence. During times of stress, children can be at higher risk of abuse. If you are under 18 or if you care for a child who needs help, call Childline on 116. It's toll-free. If you have been raped, get health services as soon as possible, within 72 hours to prevent HIV and unwanted pregnancy. These services are free and always available, even during lockdowns. Get help at your local police station, health facility,
Hi, how are you?
or the GBV Command Center.
Good, thanks. It's Rebecca
428-428. This message
Look,
is
I'm
brought
looking
to
at
you
your
by
follow-up
NACOSA,
questions. I
with
wanted to
funding
check
from
if
PEPFAR
you
and
wouldn't have a
USAID.
problem being anonymous and
Ashifa
talking to the
Breakfast.
doctor on air, so he can sort of explain the
Situation,
difference
we're going to go to the
between
lines now. Okay, good morning, team. There's an accident
stay on the line, no?
Kakona Thabo Mbeki and Box Street. So Thabo Mbeki na Box. Ziko Dana. Thabo Mbeki. Na Box. Yeah. Yeah, down there. Yeah. Hello.
What happened?
The bus was going down Katawombege and the taxi was going inside the town.
The bus, what type of bus? Is it a planned patient transport or is bus?
The Great North.
Great North.
Yeah, Great North.
Bus is at the village. Mara,
Mara.
What do they want?
Mara.
GNT is for villages. But what do you Eben, the Madodi. Yeah, no.
I.
Oh, Bafrustana the traffic lights. Not the GNT. Tropo Arnoitwella for Bahwaduba once. Poetex. Bus literally being thrown under the bus in that Poetex.
Literally. Wow.
These accidents are necessary, Jading. What's what?
Yeah,
Depo yabona that side yabola dana next to Husiami. Urimutropo.
Ashifa Breakfast, Monday to Friday, 6 to 9 a.m. on Energy FM and Choice FM.
If you don't know, now you know.
Conversations with Rebecca Pala.
The content in this segment is not suitable for listeners under the age of 16, and parental guidance is advised.
The time is 23 minutes past 8. This is Conversations on the Energy FM 102.1 and Choice FM 101.1. I'm in conversation with Dr. Maluleke. He is our resident gynecologist and he's currently answering all of your gynecology-related questions. If you still have a question that you would like for the doctor to address tonight, this is how you can get in touch with us. Our WhatsApp text line is 079-295-1212, 079-295-1212, or you can send a voice note to 060-771-5107. So, Anonymous, whose question we dealt with before we went to the break, doctor, who was talking about bleeding for quite some time, getting medication but still bleeding afterwards, joins us on the line now because she has asked follow-up questions and we thought it might work best that she asks the questions to you. Anonymous, good evening, welcome. The doctor is listening. He has already answered the first part of your question. I understand you have a follow-up. The doctor is listening. You may go ahead.
Good evening, ma'am. The tablets you mentioned is not what I was talking about. Visan is what we give to people with endometriosis. I'd like to think that whoever gave you that was believing that you are probably suffering from endometriosis. I'm not too sure if that has been confirmed, because one way of confirming endometriosis would be to do a diagnostic laparoscopy, where they'll go and examine the internal structures. But Visan is treatment for endometriosis. The pill I was talking about would be the combined oral contraceptive. These are hormonal drugs that will regularize your cycle, and you will take them as long as you are not intending to fall pregnant. If you want to fall pregnant, there are other medications that will be given to stimulate ovulation. So the pill I'm talking about would be the oral contraceptive. Definitely. No question about that. It's one of the functions of the oral contraceptive. People think that the pill is just for conception, but it can be given to treat irregular menses like the ones you are having, or excessive bleeding. We give the pill to correct that. So it's one of the things that you can use the pill for.
You clarified, Anonymous. Okay. Thank you so much. Okay. Good evening, Rebecca and Doctor. I want to ask if it is normal to have brown discharge a day before my period and go on with the period for 2 days, then for 3 days, nothing is happening.
Yes, the brownish discharge that precedes menstruation is quite normal for some people. And the listener will also will have noticed that it happens every cycle. And for her, we regard that as normal. It's only a worry if it's something new altogether. It's something she does not know. It's just starting now. Then it could indicate there are other things. But if it's something that happens in her situation on a cyclical basis, we don't think that's a problem.
Okay. Hi, Doctor. I used Depo in March. My return date was June, so I did not continue with it anymore. Then now I can say that I have 4 months without the injection. I had intercourse last week, no pregnancies occurring. What can I drink for fertility? I'm asking for this because I need to understand. It was my first time in 2021 March where I injected with the Depo.
Well, if she is intended to fall pregnant, yes, she might need to be given ovulation-inducing medication, because Depo is one of those injections that last longer in the system. If she stops getting the injection, fertility is not likely to return immediately. So she might need to be given medication to try and assist the process. So she needs to go and see her doctor, explain the situation to the doctor. One of the things that might be done in actual fact, Rebecca, remember that when you are on Depo, most of the people will not menstruate. So they might start with a pill, which is a paradox in the sense that you want to have a baby, but they give you the pill. They give her the pill to try and bring her cycle back to normal. Okay, they'll give the pill for a period of 3 months. Once the cycle is now normal, because the ovulation-inducing medication is not given randomly. We give it depending on when your period was. So if you're not menstruating, we would literally be shooting in the dark. So they will give her the pill. Once the doctor is satisfied that the cycle is now regular, we then switch to ovulation induction. And that way she can conceive.
Okay.
Right.
Ke gopela thuso na le molekane wa ka re na le mengwaga e mebedi re ratana e fela ga ke ime, Doctor.
Go ra gore o ne o thata felo fao. Ge ba na le mengwaga e mebedi ba sa šomiše thibela pelegi ebile ba kopana e seng ka tlase ga 3 mo bekeng, not less than 3 times per week. Ka morago ga ngwaga o dira seo wa se be le ngwana go ra gore go ne bothata. Bothata bo ka ba mosading, bothata bo ka ba monneng. Go na le tsela e tee fela ye ba tshwantse ba e tšee go ya ba bona ngaka o tlo dira diteko mo go bona mo go mosadi re lo tlhatlhoba gore na mae a šoma jwang ra ba ra tlhatlhoba gore na ditšhupu tsona di gabotse na monna o nyaka ga peu ya gage e romelwa kwa laboratory bo re a tseba ba e lebelela then ba re fa dipoelo tša go re tsebiša gore na peu ya monna e jwang so a se bothata ba mosadi a etee ke kwa re a ke ime o be a tshwantse a rile ga re ime nna le monneng.
Okay. Doctor, before we part ways, Sharon is on the line. Sharon, Charlotte is the one whose question we answered just before this one about having used the contraceptive for the first time. Yeah. Charlotte, good evening. Welcome. Hi, Charlotte. The doctor is listening. What would you like to ask?
Yes. 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 It is the Depo takes time to get out of the system. Even if you got one dose, it might not be eliminated immediately, right? So if you are normal, in other words, your womb is normal, the tubes are normal, and the man is normal, you will definitely fall pregnant at some stage. It's difficult for one to predict when, because people's bodies are not the same. There are those who will actually fall pregnant as soon as they stop getting the injection, but those who will take time to eliminate it from their system. Yes.
Thanks, Charlotte. Okay. Doctor, please share your contact details.
We are in Polokwane, 72A Compensati Street, 015-295-9407 or 295-9419.
Okay. I'm going to ask you to repeat that one last time, because when you leave, people start saying, Doctor, but Rebecca, it's like you were rushing the doctor. 015-295-9407 or 295-9419. Okay. I hope that it has been noted down. Doctor, thank you very much. Our next appointment is next Thursday.
Thank you and good night.
Good night, Doctor.
All right.
Okay, coming up on Energy FM is Night Flight with Martino Manaka, and Stanley Brown is coming up with exclusive nights on